In this exercise video, we're going to be going through how to use a pelvic wand to do some internal release to your pelvic floor. This will help decrease tension in the pelvic floor, help with pain, and can also be used as self-treatment between sessions. So first thing you need to do is make sure you have your pelvic wand. This is the Intimate Rose one. That is my favorite, and they have a couple different styles. One that vibrates, one that goes hot and cold, and some different style lengths. I'll put a link in this below if you need to order this. So pelvic wand here, what we're gonna do, if we're gonna use this vaginally, we're gonna use this more fatter end. This is the part that's going to be inserted into the vaginal canal to find those trigger points and do internal release. This other skinnier end is going to be the part we hold on to as a handle, so that way we can reach easier. So we're going to be holding on to the skinny longer end, and the fatter shorter end is going to be what we're inserting. So what we're looking at here is the pelvic floor, and this obviously is the vaginal opening. This is where we're going to insert the wand into. So as we're holding onto the handle this way, we're going to have it facing us. So the point that's going to be inserted should be facing straight towards us, and we're holding on to the opposite end of the handle. So when we insert into the vaginal canal, it should be slightly pointing back towards your tailbone. So I'm going to take off this layer here so I can show you where we're aiming for when we're inserting. So we're going to insert into the vaginal canal. And then once we insert, we can do those superficial layers because there's 3 layers. So that first layer is going to be just on the inside of that vaginal opening. And so we're just kind of hooking the wand into that first little layer, where basically just like the first inch or so is inside the vaginal canal. You can gently press and hold right there at the center, right as you enter the opening. And we can hold there for either holding for 30 seconds to a minute while you're doing your deep breathing exercises and trying to relax and lengthen the pelvic floor. Or you can do shorter holds if that longer hold is too intense. So you can hold for 10-15 seconds if that's more tolerable, and then back off on the pressure and then repeat. And so we usually will use like the face of the clock to tell you what direction you should be aiming for when we're using the pelvic wand. And so if we're inserting here, we would say the tailbone back here is 6 o'clock. And so we would start off maybe going straight down towards 6 o'clock, and then we can go directly off to the side a little bit, and that would be 5 o'clock, 4 o'clock, 3 o'clock, and so on and so forth. So we can use that. So if your PT is like, well, I need you to aim for 7 o'clock on your left, that will give you a visualization of what you're trying to aim for with that. So that was just talking about here at the opening. This could also be used for birth prep if we're trying to prepare the pelvic floor for a vaginal birth. Now, if we're going to go deeper into the other layers, still inserting the same way, still facing back towards the tailbone, but now we're going to insert the wand just to the curve to get to layer 2 muscles and tissues. So from the inside, if we are just to the curve, you can see that now the tip of the wand is getting into some of the deeper muscles. And then if we go even farther, then we can get even farther back, all the way back to like the tailbone area, where if you're having a lot of deep pelvic pain or tailbone pain or pain with going to the restroom, this could be the area that you need to work on. So those are the different layers, from superficial all the way to super deep. And obviously we're just inserting farther and farther onto the wand to get to those spots. Now, when you're first getting used to it, it's going to take some time to figure out where you need to go and exactly what angle and hand position is best. So you're going to want to fiddle around with it until you find it. But you're going to know you found it because you're going to have a reproduction of your symptoms, whether that is pain or a lot of tension or pressure in your rectum or anything like that. you're gonna know you're on that spot when you have those symptoms coming up. So again, you can hold that pressure and just hold and breathe for longer stretches of time, 30 seconds to a minute at least, or you can do smaller holds if you feel like the long hold is intolerable. So 10 to 15 second holds while you breathe. But the key to this is always doing really relaxing breathing, finding a very comfortable position to do this in so you don't feel like you're tensing up or guarding. So for most people, it's going to be laying on your back or in a reclined position. But I have had people use it like standing in the shower as well. Now with the wand, you're going to want to use some lubrication to make sure we don't have any friction, especially if you have pain with penetration and entry pain. So use some lubrication with the pelvic wand here. This is silicone-based wand, so you don't want to use a silicone-based lubrication. You're going to want to use a water-based lubrication for this to help make sure you don't break down the integrity of the actual wand surface. You want to make sure you clean it and sanitize it after each use. And I would recommend re-sanitizing and doing a quick wash before you enter and use it again. For the pelvic wand, use the instructions you've been given to by your PT on what angle and what depth you should be aiming for. And also use the recommendation given on frequency. But for the most part, most people are only going to do this 2 or 3 times a week at most. And not every day, because that can be a bit too aggressive. So this is how we're going to use the pelvic wand and how to find those muscles and where to aim for. The link for the wand will be down below.